Here are 5 big recovery mistakes that plastic surgery patients make. Mistake number 1 is not staying well hydrated after surgery. Drinking lots of fluids and staying well hydrated is crucial after surgery because there could be fluid loss during the surgery itself. It's important in the healing process, it's important so you don't get dizzy or lightheaded or have any other issues. I've actually had some patients tell me they refrain from drinking water after surgery so that they don't have to get up and go pee, but that is a huge mistake. It's so important that you stay well hydrated after surgery. Mistake number 2 is not taking a strong bowel regimen after surgery. Patients can often be very constipated after surgery from both the anesthesia as well as from narcotic pain medication. Constipation can be really uncomfortable, so we highly recommend that patients take a strong bowel regimen after surgery, like Dulcolax, Miralax, things like that. Of note, you cannot take enemas or suppositories after surgery because those can in fact lead to bleeding issues and complications. Mistake number 3 is not following activity and exercise restrictions or going back to work too early. The activity and exercise restrictions and work restrictions are in place to help with the healing process. If you exercise or lift weights, or depending upon the nature of the work, go back to work too early, it really can compromise their surgical result and lead to healing issues. Of note, light ambulation is always encouraged after surgery because it's important to keep up with circulation and prevent blood clots. Mistake number 4 is not transitioning to non-narcotic pain medication a few days after surgery. Most patients within a few days after surgery can switch to non-narcotic pain meds like Tylenol or ibuprofen, and these can actually control your pain pretty well when taken appropriately. Narcotic pain medications obviously have a lot of side effects. They cause drowsiness, they can cause constipation, obviously they can cause addiction as well. So it's always important to get off of these medications as soon as possible when appropriate. And so it is important to transition to these non-narcotic pain medications, which can control your pain pretty well, and when taken appropriately tend to have a more mild side effect profile. Mistake number 5 is not immediately notifying your surgeon if you think that something may be wrong or something's up. If you think that something may be wrong, it's better that you contact me ASAP and tell me your concerns and maybe be wrong and everything's fine. Then you say, you know what, let me watch it for a day or two and then I'll notify Dr. Schwitzer if it gets worse. No, you gotta notify me immediately, because if you wait to tell me and there actually was an issue, it could make what's happening much worse and much harder to treat. So for example, let's say you've had a breast augmentation, another surgery done, and you notice some redness in the area. You should let me know ASAP rather than saying, let me wait a day, let me see if it gets better or worse. For example, if there's an infection, early stage infections can almost always be treated with oral antibiotics, but if you wait a few days, oral antibiotics may not be sufficient. So if you think anything may be wrong or you're concerned, let me know immediately. And my patients actually have my cell phone for that. Can you cut out and my patients have my cell phone? Just cut that out. I don't want to have that. So there you have it. Those are 5 big recovery mistakes plastic surgery patients make. If you have any questions or comments, you can either comment below, you can DM me. For a consultation, you can follow the link in my profile above.